I would like to present one patient who presented with critical limb ischemia, and for which I did a transbrachial angioplasty. So he's a 62-year-old gentleman, non-smoker, not a diabetic, not a hypertensive. He presented with bilateral buttock claudication since 6 months, and he had buttock claudication to the severity that it was limiting his daily routine activities. And he was evaluated initially by many orthopedic surgeons, and he was undergone a lot of investigations by the orthopedic surgeons like MRI, spine and all, with no relief of symptoms. And finally he was referred for evaluating a rule out the vascular cause for claudication. And clinically on examination he had feeble femoral pulses more on the right side with an ankle brachial index of 0.7. And the other systems were within normal limits, and on investigations ECG, echocardiogram was normal, and he underwent a Doppler evaluation which revealed an ischemic flow in both femoral arteries. And he was taken up for a coronary angiogram and peripheral angiogram. Can you please play the peripheral angiogram? Coronary angiogram was normal, and the approach was through the left femoral artery, which showed a critical stenosis of the osteoproximal right common iliac artery. And the sheath injection on the left side revealed a tight stenosis of the left common iliac artery as well, which was calcified also. So this gentleman has bilateral common iliac artery stenosis on both on the right and the left side, and my plan was to tackle both in the same sitting, and a left transbrachial approach was selected for this. And I inserted a long sheath, 80 centimeters sheath, 7 into 80 centimeters sheath, and it was placed at the common iliac artery ostia. And the lesion was not simple. The lesion was crossed with a thermo guide wire and exchange link thermo guide wire, pre-dilated with a peripheral balloon. And on the left side, stenting was done with a 6 into 150 millimeter silver stent with good result. But the lesion on the right side, it was very tough. The right side lesion was not fully dilated even after repeated dilatations, and I used even a 7 into 60 millimeter balloon on the right side, and there was a residual stenosis of around 40 to 50% on the right side. So I did not stent the right side, but the pulses reappeared post-procedure, and this was a final result. On the left side, the stenting was done. On the right side, only balloon dilatation was done. And he had also prompt symptomatic relief post-procedure, and he was discharged on dual antiplatelet therapy. And this case is presented to highlight the ease of transbrachial approach in bilateral common iliac artery involvement. Thank you for the patience.